we are excited to become a really big player, ultimately powering the future of primary care and personalized medicine. And that's our goal. The current systems that power our healthcare, they look at just this like really narrow portion of what someone's data is of this medical record, right? And that's going to be creating a massive detriment to delivering great care as we look at all the breakthroughs happening, all the understanding of like how personalized and nuanced we can get with somebody's health. That's just not going to be how things work in the future.
Welcome back to the Fitt Insider Podcast. I'm your host, Joe Veneri. Today I'm joined by Sunita Mohanty, co-founder and CEO of Vibrant Practice. In this episode, we talk about building the AI-native operating system for modern medicine. Sunita shares her personal health journey, how it inspired her to rethink the electronic health record, and why Vibrant is purpose-built for functional, longevity, and preventative care practices. Plus, we discuss human-in-the-loop healthcare, shifting from insurance-based systems to consumer-centered models, and how Vibrant is powering the next generation of clinicians. Let's get into it. The Fitt Insider Podcast is presented by EGYM. EGYM's smart fitness ecosystem is transforming healthcare through exercise. Combining strength equipment with AI-powered software and corporate wellness platform WellPass, it's leading the shift to proactive preventative health. Learn more about EGYM's intelligent workout solutions at egym.com. Hi, Sunita. Welcome to Fitt Insider. Thanks for joining us.
Thanks, Joe. Thanks for having me.
Yeah, let's start from the top. Why don't you introduce yourself and tell us about Vibrant Practice?
Great. Well, I'm Sunita Mohanty. I'm the CEO and co-founder of Vibrant Practice. We're building the AI native EHR specifically for personalized medicine, shaping the future of what modern medicine is going to look like. Our practices are data-driven, they're high touch, and they're delivering forward-thinking care, and they don't have tools and systems that have been built for them. So we've really been able to build a system from scratch that meets their needs. My background and my co-founder, we're actually not clinicians, we're technologists. And I was previously running an AI team at Meta, building the AI experiences for the Meta Ray-Bans before starting Vibrant. When I was in this role at Meta, I actually had an autoimmune disease diagnosis. And so while I was thinking about what the future of consumer experiences are going to look like and how AI native everything is going to be in this world ahead of us, I had this crazy experience where I had an autoimmune disease diagnosis. My allopathic doctors were telling me surgery was my only option. And I thought, hold on a second, let me see what else is out there. Let me see. I don't want to be on surgery. I don't want to get surgery and then be on medication my whole life. And so I was really grateful to have, first of all, gone down the holes of Reddit and found that root cause medicine exists and functional medicine, and people like me were getting back to health with that approach. And then I found a doctor who worked with me with just a lot more diagnostics, a lot more data, and a clearer picture of what was happening. And within this process, I was able to get back to health within 8 months and avoid surgery altogether. And so for me, it was a deeply personal experience that, while I was building and designing the intersection of how AI is going to impact our lives, I thought it's just an inevitable future that we will be living in where our health will be more personalized. Our experience of how medicine and healthcare works will obviously not be so kind of cookie cutter, but it'll be much more fine grained. And I just got obsessed. And so that's where Vibrant came from. That's where, this experience of mine really shaped my insight. But, the reason why we're going after providers is because I care deeply about the role that providers are going to play and clinicians are going to play in this future of medicine. I think deeply that we still are in a world where, humans in the loop are really an important part of the journey of care, not just because of human judgment, but also the act of healing and of being involved in somebody's journey and having that, sense making. And so as we started digging into the problem that way, I noticed, this problem that clinicians are facing, which are the tools that they're using to run forward-thinking practices are just really stuck in, things that were built 10, 15, 20 years ago, which is like mind-blowing. And so these doctors who want to practice forward-thinking care are not able to rise up to the patient volume, the types of businesses they want to build, and just to do all that they can. And so that was where we got really excited and saw the opportunity to build Vibrant.
Yeah, I think it's really interesting and obviously much needed at a time where we see more kind of emerging functional medicine, integrative medicine, longevity clinics and protocols. And maybe for someone like myself, not kind of super knowledgeable about what types of operating systems are they running on currently, or do you see them transitioning from? Is this just a traditional, electronic health record or primary care software that they're out of a box trying to fit into, as you say, like this forward thinking way of practicing medicine? Like, how do they navigate that now?
Great question. So today, yeah, these doctors, and we're working mostly with independent practices. It can be anywhere from like a micro practice, one doctor to 20, but still not hospital systems that are using Epic. We're working with the long tail of independent practitioners out there. And for most of these practices, they're using some EHR software that has probably been built for primary care, probably been built for billing flows, like insurance billing flows. Most of all, is really what EHRs exist for, and not for this building an understanding of a patient. And so, they start with that, and then they realize they need to do so much more on top of that. They're getting all of these labs and diagnostics. So now they're data scientists digging into spreadsheets and putting together their own spreadsheets, or maybe adding a platform that might be doing some of this, like wearables dashboards or things like that on top of their EHR. And then on top of that, you have your AI scribe. And on top of that, you have like a platform to order labs. And on top of it, so you're just like stacking all these things that all of a sudden you're passing context of what's happening with one patient and one provider across like 6 or 7 different systems, right? And so, what if we just flip that on its head and made that relationship the center point, and all of the sort of workflows around that just in one place? And so that's what we're able to do. And then, building something today in 2025 is a remarkable thing, to just be able to leverage AI in so many ways that you can rethink workflows and just challenge the assumptions of like, well, does it need to be that way? Does it need to actually take that many steps? Does it need to involve this approach when, we can think about faster ways to get there?
I mean, one thing that immediately kind of pops in my head, and of course, I have my own preconceived notions and answers to this, but I'd like to hear you kind of speak to it. It's like there's no shortage of people who have kind of said, "Oh, we're gonna build the modern day Epic. Like we're gonna do the EHR. We're gonna like start here, and we're gonna transform healthcare." And there's all types of reasons why that hasn't worked and why it's super difficult. But in terms of you looking at that, like why was this the kind of go to market and the opportunity to say like we can really have an impact here and it can work versus trying to take on the entire $5+ trillion healthcare system?
Yeah, yeah, it's not where I intended to build a company, to be honest. So I agree with you that like it's kind of counterintuitive, and we've seen a lot of all the investors and founders will say there've been scattered bodies along the way who've tried to do this, but I do think there's a few things that are just different today, and the reason why we got here was actually because we started with a slightly different model of more of an MSO, a managed service organization, trying to help providers who wanted to practice this way. So we were kind of stitching together other technology with like a little bit of a layer on top. And the main thing we realized was how faulty that becomes and how shaky that foundation becomes, especially as we look ahead into how agents work, how much more value there is in having the system of record, but also the agents working on top of that, so that you can, because a lot of the challenges with these agentic systems that don't have the system of record is like the minute one thing breaks here, you just can't trace it through. And you have so many kind of a house of cards that starts to happen and stack up. And to be honest, we were also just so frustrated with the brittleness of the existing technologies and how you could add agents to it. And so both my co-founder and I, we are technologists. And so we just saw this opportunity. We just kept hearing it over and over again from all the people we were talking to, all the providers. And I think the reason that, I was okay with it was because actually we pressure tested all of our assumptions. We started with the first assumption that people come to this with, which is, nobody wants to change their EHR. Like that's such a pain. It's so difficult. We've been through difficult things before and don't want to do it again. And we're actually in a moment in time that happens every, kind of 10 to 15 years, which is a technological platform shift. Like the last one was mobile. Before that, it was web. And we're seeing people use Chat GPT, use these AI native platforms, and then go back to their technology that looks like it's now built in the Stone Age, and they're expecting so much more from it. So the willingness to actually make a switch is much higher than it's ever been before. And I think it's also like the cost of not switching actually outweighs the cost of switching, because the amount of time that you're losing in just these old workflows. So I really spent a bunch of time kind of pressure testing that, understanding that. Now, obviously, everyone doesn't feel this way yet, but we're seeing more and more and more people continue to kind of go up that curve. So that's one reason. And then I think the other reason is like we can just build faster. This is a lot of product to build. It's a lot to build. It's a very difficult thing to do, but the speed at which we can build and the components and the foundations that we have now to build something like this are just very different than what has existed before. So, I think we're starting in a different segment of the market than Epic, but we are excited to become, a really big player, ultimately powering the future of primary care and personalized medicine. And that's our goal, is to the current systems that power our healthcare. They look at just this like really narrow portion of what someone's data is of this medical record, right? And that's going to be creating a massive detriment to delivering great care as we look at all the breakthroughs happening, all the understanding of like how personalized we can get with and nuanced we can get with somebody's health. And that's just not going to be how things work in the future. It's all about context, right? As AI becomes more and more woven throughout everything we do, the importance of a full picture of context is really what matters. And so that's the premise with which we're building, Vibrant, is that it's first starting with a really full picture of context around a patient. And so to make sense of that, you have to have an AI layer on top of that. And that's the only way it'll work. And so that's what we're equipping clinicians with.
With this kind of entering this new kind of computing and future, really, as you described that evolution, how much of that, so there's this willingness to potentially switch or evolve with the times as you're getting exposure to it seemingly like everywhere you go. How much of it is also the hurdle of like education and utilizing it in everyday life? So let's say somebody, a clinician, they do opt for Vibrant. What does that kind of the switching cost really look like in terms of this is how we get it kind of turned on? This is how quickly somebody can adapt to it. And this ultimately at the end of the day, whether it's, preventing burnout or getting better health outcomes or growing your clinic faster, like what types of benefits are they seeing in real time?
So we're now live with about 50 clinics, and we launched our platform in 2025 and into beta, and then just kind of mid-year we started turning that into powering clinics fully. And so we're seeing some really, really exciting stuff. I mean, one, like everybody has retained, everybody loves the platform. They run up to me and hug me. Like it's crazy. I've never seen this kind of enthusiasm before. And I'm hearing things like, I can't imagine my life without Vibrant. I can't go back to the way things were before. Something that took me 10 hours is taking me 30 minutes. And then my favorite one that I've heard recently was actually, I didn't realize Vibrant was actually going to teach me things. And I'm sitting there as I'm going through working with a patient and I'm learning from the system because I can't keep up with all that's happening. And so I think the benefits that we're seeing are covering not only time savings, which is a massive thing, right? And that translates, we haven't done like specific studies on this yet, but we'll get great data on how much more efficient you can run a practice. Like people today are sharing that, it means I don't have to hire added staff to support a bunch of the admin and ops of what I do. And so that's great. But then this other thing of like, I'm actually learning and delivering better care is what I'm obviously most excited about. And so to your first question though, like how does somebody get onboarded to it? I think the other nice benefit of kind of building at this moment is people are using these tools freely, like Chat GPT or even scribes, like AI scribes, for not having to take notes anymore. And so we get to ride along with this behavior change that's happening. That's one bet we're making. But we also are doing a lot of education. We have a newsletter called The Modern Clinician where we share tips and vignettes every week about how clinicians are experimenting with AI. Because the truth is everyone's experimenting, right? Like it's all changing so fast. Nobody is an expert, and everybody is an expert at the same time. It's sort of we're all growing. And so I think that's what's really cool. But we are also seeing, as a part of that, the value of community, sharing with each other. Everybody who's in Vibrant right now is in a Slack channel together. We have clinicians who are using Vibrant who are actually teaching others and helping them onboard and helping them kind of dig in on where the edges are and what works best. And I think we'll just be doing a lot more of that into 2026. I'm super, super pumped about our kind of community aspect.
This episode of the Fitt Insider Podcast is brought to you by EGYM. EGYM makes some of the most innovative strength training machines on the market, but that's only one part of their integrated ecosystem. With connected fitness equipment, AI-powered gym software, and a comprehensive corporate wellness offering, it's forging the future of preventative health. Partnering with companies worldwide, EGYM's WellPass program improves employee health by expanding access to premier fitness and health facilities. Upgrading gym floors, EGYM equips every operator with smart equipment and AI tools to create hyper-personalized training plans for every exerciser. Putting it all together, they're transforming healthcare through exercise. Experience the power of EGYM's ecosystem at egym.com. As you're talking about this and preparing for this conversation and even having an awareness of Vibrant, kind of even looking at the website and the kind of, it's bright, it's clean, it's fresh, it's modern in the way that a lot of other, not just softwares in healthcare are not, but just softwares in general certainly aren't. And it almost feels like a kind of consumer platform in that, like, it's thoughtful and the messaging is clear and those sorts of things. So in thinking about that, we've talked a lot about on the consumer side, like this idea of a personal health OS, right? Where you're tracking all your wearables, you have your labs, you're doing your preventative scans as a consumer, right? Essentially an electronic health record that you have some type of like agency over. How much of that, even from like the clinician view and enabling that for an individual? So I guess the question that I'm building towards is like, how does that change the patient experience that you have something like Vibrant versus something archaic?
Yeah, I love that you asked that question, because we think that's a huge part of what we enable is clinicians who are able to deliver more consumer centric care. Like, as a patient, that's what I want. As a clinician, that's what I have to keep up with. If I'm a clinician, I'm competing against all of these telehealth, direct to consumer kinds of things now. And the expectation as a patient, it's just risen. You're coming in with, your chat GPT, your function health, all of these different like pieces of data. So patients are just so much more equipped with a lot of understanding. And so to kind of be stuck in a world where your patient has to like go into this really difficult to access portal and like doesn't have any data in it and has to dig in to understand what they're doing, it just feels so backwards, right? And so part of Vibrant is also a patient app that all of your, any clinician that works with Vibrant can offer their patients access to this app. And it is very consumer centric. It is, or consumer grade is our goal. You can easily message, stay kind of easily schedule. And then also we're building out this roadmap for how clinicians can work with patients on their health. And so that will incorporate things like wearables and seeing all of your data in one place, but also then having on top of that, so the idea is like, let's give everybody the same view of information. So I want the same view that my doctor has, and I want a total view. I want a total picture of it. And then I want to know like where we're going. Now, the thing we haven't added yet, but we will be adding, is a patient-facing AI component. So right now there's actually no AI that patients like interact with or ask questions of. It's all just messaging with your doctor, messaging with your clinician. So we really have built the whole system as a clinician in the loop. And that's intentional. We want to be really, really buttoned up and feel like our AI is super trustworthy. And also that it's not just like a patient talking to chat GPT, but it's actually a patient talking to an extension of the clinic that they're working with. And so that's the way that the patient-facing AI is going to evolve. So yeah, I think that's 100% front center, very intentional with why we've built Vibrant with this consumer-centric vibe, not only for patients, but I think the other great thing I hear from clinicians is who use our, people, when I do demo calls or show them the platform, they say, wow, it's the first time that I've come into a system like a electronic health record And I feel like my nervous system is just like settling. It's not like getting activated, from just seeing like lots of ugly things. Like, so we love the Johnny Ive approach to design and keeping things elegant and simple and not overcomplicating things. Obviously, it's very complicated information and complicated work, but I think there's a way to bring simplicity back to it that a lot of people miss.
For sure. That kind of patient consumer question was somewhat leading in that when you do have this world in which there are, and it's a great thing, right? All types of different preventative wearables, scans, labs, all those clinics. On one hand, it's fantastic. You're getting more information and more control over your health. On the other hand, like you kind of arrive back at this problem of everything still lives in silos. It's not talking to each other. How do I make sense of it? To your point earlier on, like with a human in the loop and a clinician, like now we're able to start to drive outcomes and really make a difference. How do you see that kind of ecosystem evolving, right? Because there is the line between wellness and healthcare and medicine, that's all blurring, all the different service providers, insurance playing into this. Like, where does Vibrant sit in that? And like, how do you just see that evolving?
Yeah, I think we're at such an exciting moment in just the rapid pace of innovation happening. You have all of these diagnostics, and a lot of that's coming consumer first because the evidence on it is not yet at the state where it's going to be reimbursable, and insurance is like lagging on that. But why should that hold it back from actually being accessible, right, to consumers? And I think we're also seeing, other kinds of therapies and treatments kind of fall into that category of like really promising. There's kind of early data on it, and so it's not yet reimbursable, but that shouldn't hold it back from patients who want to use some of these therapies or could benefit from it now. So I think we're moving to a world where instead of insurance being the gating factor of why somebody gets a certain kind of modality of care, it really is going to move to a patient's personal risk tolerance. And that risk tolerance, I think, is a tricky thing because that means that this patient has to be informed about what the risk is of all of these different treatments and things that are going. And so now you have this fire hose, right? Of like, I heard this on social media, or I heard this from this person. And even, me as a relatively informed individual, I still like need to ask an expert who can say like, how should I really look at this data, or what data do I need to be calling up? And I can't just blindly follow what we shouldn't just blindly follow what we hear, even though we do. I'm one of the biggest kind of like will buy anything that's sold to me on Instagram. But I think that's the challenge, right? And so I think in this world of increasingly rapid innovation, the need for distillers of information, of like translators, and that translational layer, it becomes even more important. And so that's really what we're trying to enable with Vibrant, is this translational layer of, amazing expert clinicians and coaches, or it might be like this role of provider can kind of shift in terms of exactly who's doing the work, but somebody who's an expert in understanding how to work with this kind of data. Also, that translational layer is like distilling data, but understanding the person that they're working with, and for what might be the right thing, or how can you help that person see around the corners. And so that's really the layer that we're sitting. And then the one other point I want to call out is just from a business model standpoint, what I think that means is the future of healthcare. I think, yes, insurance dollars are so important, and we will be enabling insurance billing soon. But we actually started with cash pay practices, and that's an area to move faster with. It's not where we're kind of containing ourselves to, but I believe deeply that working at this intersection of hybrid business models, where you enable insurance plus cash pay, so that you can give patients risk tolerance, the control seat, is really where we need to go with health.
There's a lot of, and it's still early, but a lot to suggest not only are people willing to pay a premium for preventative health services, and yes, maybe the insurance backing is not there yet, and so on and so forth, but the diagnostics, the scans, the prevention, just the awareness about their health is, we go down this path of then that enabling more cash pay providers to exist. do you see what came to mind was like a Stripe Atlas, right? That is just like a basically not only you're the health record, but you're just like the turnkey clinic software essentially for a provider to use as they think about moving into this space. I guess how much thought have you put to that? Is that an aspiration, or is it more purely like, hey, we want to be there and we want to serve this role as the kind of software layer and the agentic layer? But yeah, how much of it are you thinking about as like kind of a launch pad to enabling this entire space?
We actually started more with the Stripe Atlas model, and then we realized we kind of had to pick and choose our battles as a young startup with few resources, and so then we shifted more towards really building like the tech stack and building our DNA as a tech company building this out. But there is a definite world, and we are actually doing a lot of programming around this where so many of our providers are just getting started. They're just taking the leap. There's a lot of like playbooks, and learnings even from people within our community. So we had a webinar a couple weeks ago with some providers who just started this year who were growing super fast, and they were sharing their learnings and kind of answering questions from people who were challenged. So I think there is definitely a role in a world that we play with that. But yeah, initially, I think the other thing is we didn't want to constrain ourselves just to like this kind of startup market yet. It is very much where we're seeing a lot of growth, but now we started seeing a lot of interest from larger clinics who are like, I want what you have. And so that was a big part of kind of opening up our aperture.
As we kind of look ahead, we're recording this in 2025. It'll come out in early in the new year. So of course there's like a lot of planning going on and a lot of roadmaps. But just in general, you mentioned, I think it was like the beta and having 50 clinics and starting to really kind of now expand that. Like what's top of mind for you in terms of priorities and focus areas? I know still an early company, so it's like the answer is like everything. Obviously, like
That's
we're trying to
exactly
do everything
it.
and trying to do
Yeah.
more of everything and faster and all those things. But yeah, if you could distill that or even just say like sometimes I phrase it as like, what are you most excited about? If there's so much going on that it can be overwhelming. Yeah. So what comes to mind?
Yeah, I mean, I'm a deep like product geek. I love product work. I love like where we're going to take the product. I'm so excited about, I think we're just scratching the surface. And so early in Q1, we will be launching some really cool stuff around more visualization and wearables and some more really exciting features there. So more to come there. And I think that really starts to unlock some of the true data capacity of our platform. So really, really excited about that. And then just more kind of ways that we are pushing our UI and our thinking around being AI native. A lot of fun things to come, and just we've got an amazing team coming together. Also, a shout out to say if you're interested, we are hiring all roles. So designers, engineers, sales, especially those categories in particular. And then the other piece outside of product, we're going to be pushing a lot into community. So community partnerships and kind of ecosystem building. Like one of the big things I believe is that we will only be building this alongside so many other really amazing partners. And whether it's diagnostics companies or a company like Quicksilver, we're looking to do something with them soon. But there's such a great constellation of vendors and companies that are enabling this kind of personalized care and enabling clinicians and patients to get great care. And so we are looking forward to building those relationships and doing some events and cool stuff with community in 2026.
Yeah, this whole, you sit at a very unique place where being at the forefront, not only of the shift to the future of healthcare, we hope, right? The preventative and personalized and proactive, like all those things. Also layering AI and new technology, but having this human centric and kind of human in the loop and community driven, like that is a place to differentiate because you do often hear like the kind of exaggerated version of like, oh, they're AI doctors and it's all going to be automated and it's going to, everything's going to be kind of like chat GPT oriented. So to hear you kind of walking through this and explain, no, like this is enabling like a deeper level of care and interaction and the human at the right time and to be able to actually have that impact. I think that's way closer to the future than it is this kind of dystopian, like AI doctor robot kind of vision.
I mean, when you think about it and you just think about the world you want to live in, like I want to live in a world where my relationships are richer and deeper. And, I'm inspired by really awesome people who are thinking like me. And I just think like the risk of AI sending us down these individual rabbit holes that like isolate us even further is a big risk, right? And I've come from working at a company like Meta, and we've seen what social media can do, and I think that technology doesn't have to be built with that kind of doomsday kind of presence in mind. I think it just requires intention from all of us who are builders to not build for that future. So that's very, very deeply like what motivates me. I have two little kids, and I think about that all the time of like, what is the world that they're going to live in, and am I proud of what I'm doing today to create that world?
100%. Well, we will certainly be following along and keeping everybody updated at the latest out of Vibrant. But if they are interested in learning more, following along themselves, where would you point them?
Yeah, well, you can check out www.vibrantpractice.com, and you can always get in touch, Sunita@vibrantpractice.com. Really excited to, again, build our ecosystem of partners over the next year. So looking forward to that. So really appreciate the time and space.
Absolutely. We'll make sure everything is easy to find in the show notes. And like I said, keep the updates coming and keep everybody kind of in the know about what you have going on. But thanks for making some time to chat with us today.
Yeah, thank you. Thanks for all that you guys are doing with Fit Insider to create community. And, I just want to say like such a great shout out to you guys. I was so happy to get to see more of the community at Eudaimonia, and have been keeping track of all that you've been doing in a similar kind of time frame that I've been building Vibrant. So it's really awesome, and just great to kind of be building this space together.
Thanks for listening to today's episode. If you got value from the conversation, please consider subscribing and sharing the podcast with a friend or colleague. It's a massive help. And if you want more content like this, including news and insights on the latest industry developments, subscribe to the Fitt Insider newsletter at insider.fit.co. And one more thing, you can learn more about our recruiting and consulting services at fit.co. That's FITT.co. I'll see you here next week.